Mary. I'm Sarah.
Hi.
I'll be your occupational therapist
Nice to meet
today. So I hear you were in a little bit of an accident from walking your dog. How are you doing today? Any pain?
Doing good. I'm in some pain, yeah. And I'm not really familiar with a lot of the shoulder stuff, so.
Okay, yeah, perfect. We're going to go through everything you need to know about what happened. As well, we're going to talk about, exactly how it happened, what you can do from here, some exercises that'll help your recovery, and as well as some precautions and safety as well.
Perfect.
So jumping right into it, you do have an anterior shoulder dislocation. I got you a nice little handout that'll lay out everything for you. You can take it home with you and use it in that way. So with this dislocation, it's of the humeral head and from the glenohumeral joint. So I do have a lot of anatomy and handouts that you can take with you that'll show you everything as well.
Perfect.
I know you're a nurse, so this is going to be right up your alley, so explaining it's going to be easy. So why did this happen? This happened because this joint, which is a ball and socket joint, is the most mobile, making it very easy to dislocate. This is going to be one of the most common dislocations, so this is a very common injury. The top end of the humerus, the upper part of the arm, is pushed out of the joint socket in a forward or anterior direction. In your case, you had a traumatic dislocation from the impact of walking your dog. I hear that's how it happened. In other cases, it can be atraumatic dislocations. Probably nothing you need to worry about right now. That's going to be from the flexibility of the joint and the laxity of the ligaments that help support the joint. So I bet you're wondering, what are we going to do from here for treatment?
Yeah.
Am I correct?
Yeah, I live an active lifestyle and I'm a nurse, so I just need
Okay.
to know, what I can do to get better and how I'm going to go forward from here.
Yeah, and it seems like your dog is a big part of your life, so being able to take care of her
Absolutely, yeah.
is going to be a big part. So yeah, the first thing we want to do is work on reduction, which is getting you fitted for a sling right away, immobilizing that joint just so it's properly going to heal. Since you are a nurse, you're going to be active, you're going to be moving and using that joint. We want to make sure that really is well healed, and we work with treatment as well. So how long, the duration, it's going to vary. You are very young and very active, so you're going to work with your doctor and see what he thinks as well. Like I said, you're young, so that's going to have a big factor in it. And yeah, you're a nurse, so we want to make sure that is going to heal for you.
Great.
So the first 1 to 2 days, what we're going to want to be doing right now is kind of managing that pain. You did mention you do have pain, so icing, that's always going to be a go-to.
Okay.
5 minutes should be just fine. As like you said, being a nurse, you probably know that as well. Have you ever heard of TENS?
A little bit, but I don't know much about it.
Okay, yeah, so I know some nurses know about it, but TENS is another way to help with the pain.
Okay.
It's going to be an electrode placement that we could put on your shoulder. We do have a lot of handouts and information on it if that's something you want to do to help with the pain as well. Other things that we can be doing early in these stages is just active scapular elevation, depression, retraction and protraction. We can emphasize those to help keep you moving in other ways around that joint. I know you're, again, probably really, you know a lot about range of motion exercises, and we want to keep that maybe not right away in the shoulder, but around it, so distally, so away from your body, in the elbow, in the forearm, wrist and hand. And I'm showing them on my body, and later we can do it with you as well.
Okay.
Other things we can do are pendulum exercises. I can kind of go over that with you. With your good arm, strong arm, we're going to place it on a chair or a tabletop surface. And what we're going to want to do is use the momentum and not the actual action to move the injured shoulder. So strong arm down, and you're going to bend your knees up and forward like this, and use the momentum to move your arm back and forth, and
Okay.
really just get that joint moving to help with treatment as well. You can do this 3 times a day or as pain permits when you're on your free time.
Okay.
And so since you are so young, like I said, we won't need to worry about immobilization so much. This is really going to target that 35 and up group. It may need to go about 2 weeks to reduce the risk of shoulder stiffness, but we don't really need to worry about that.
So I'll definitely work on those exercises, but what are the next steps that I could do, like, moving forward?
Yeah, for sure. So in the weeks to come, looking at that 2 to 3 week mark, we can start thinking about getting rid of the sling or immobilizer, and just really making sure you're being careful during periods of activity. Don't feel like you don't need your sling. If you want it, you can have it. Keep doing those pendulum exercises. Keeping moving is going to be really important in the weeks to come as well. We can also add weight to your pendulum exercises to keep that moving as well. And then as well as those active, assistive, and passive range of motion exercises in all planes of motion to keep you moving. So yeah, and any more questions about kind of what the weeks to come?
What I need to look out for and any kind of restrictions that I have.
Yeah, for sure. So with safety, we just want to be really careful of the motion that caused your injury. So that external rotation and that abduction. So it's good to say within that 3-month mark is when you're wanting to be avoiding those exercises, those activities in your work, especially walking your dogs, how it happens. So avoiding that arm possibly for a pretty long, extensive amount of time, and using that other arm to really make sure that heals and we're not causing any pain. And pulling, especially with work, you're doing a lot of pushing and pulling, transferring. So really being careful, and like I said, watch out for that pain, and really pay attention to your body as well. When you're doing your pendulum exercises, doing your range of motions, again, being careful when you're in that external rotation or that abduction, being careful.
Okay.
And any questions from here as well we're together right now?
I'm worried that if something like this happens again, what would happen? I mean, would it just get better on its own?
There are going to be a lot of options for you as far as that goes. Surgery is definitely a big option right now.
Okay.
They're just going to go in and repair the damaged structures. A lot of that is going to be those ligaments that are going to be helping stabilize your shoulder. If that's happening, if this is happening recurrently, and you're having another dislocation, that definitely can be an option for you. It's called instability of the shoulder, and we can definitely help you with that. I hope this was very helpful for you today. I hope you are going home with a lot of resources and information you need. Feel free to give us a call if you have any more questions or need any more resources. Like I said, we have a lot of pamphlets with very good information, and I hope you have a really good recovery.
Yeah, thank you so much. This was very helpful.
Yeah, thanks.